Hi, Dr. Sasse here from Sasse Surgical. One of the topics that comes up often is, what if my sleeve gastrectomy has failed? Or just the notion in general about, do sleeves fail? And so we've had some recent research and I can shed a little bit of light on this. If you hang in there till the end of this video, I'm going to tell you the top 3 things that you can do today to solve that problem if your sleeve has failed. First, let me just say that a lot of times people blame themselves. They sort of feel the failure is their fault. And while we definitely can all do better with our exercise plan, 7 days a week of moderate exercise, so-called zone 2 exercise, and we can increase those minutes and we can be better on our diets, in the vast majority of cases, this really is not your failure. This is really kind of a failure of the environment intersecting with our genetics, our genetic blueprint. And that's really the key to understanding weight gain and obesity in general. This is an environmental disease intersecting with our genetics. So yes, we all have to be better, but mostly we're dealing with some biochemistry that is mostly out of our control. So failed gastric sleeve does occur, and we know that at least 10 or 20% of people will have failure, meaning that they regain all their weight or they just didn't lose that much weight in the beginning. And it has to do with a number of factors. Primarily, it's the intersection of the genetics and environment. To some degree, the degree to which people really embrace the program of daily 7 days a week exercise and diet. Also, there may be some technical considerations that will favor weight gain, such as an appropriate size and shape of the sleeve itself that the surgeon can create. But mostly that's been standardized over the years, and so we don't see that much variation nowadays. Occasionally you'll see some outliers, or we'll be at conferences and see that people are doing something a little weird, or leaving too large a stomach pouch, or the person's anatomy is a little bit less favorable. It may also be that certain people have their kind of hormones that reside in the epicenter of that gastric tissue may be distributed in a way that just doesn't favor their being successful with it. But yes, it's definitely true that if diabetes returns, I consider that a failure or a treatment that is in need of revising. If the weight regain comes back, that's definitely in need of revising. The most important thing is to not look at this as something that is done. I've played my last card and I've got nowhere to go with that. You can always begin with redoubling your efforts to the diet and exercise programs I mentioned. You can consider adding weight loss medications to the mix, but then really give consideration to revising the surgical approach. Because the surgery in the hands of real experts who focus on revisional surgery has become so much safer and so much less invasive over the years and decades, it really makes the most sense to get an opinion there and to see if the sleeve can be revised and jump-started to make it more effective. And kind of the best kept secret, I guess, of bariatrics is that nowadays we don't need to think of it as a one stop, I played my card and it's over, but really need to think of it as a long-term battle. Just as if your hip replacement failed after 10 years or 20 years, you would go get it revised so you could walk and be active. Likewise, if the sleeve failed, it needs to be revised so that you can reverse the diabetes and live a long, healthy life. So what are the 3 most important things that you can do? Well, the first is to take stock of where you are today. What is your height, your weight, your BMI? What will your insurance cover for revision? The second thing that you can do immediately is to seek out the surgeon who is an experienced surgeon with revisional procedures and look at making that appointment so that you can get an opinion from someone who can look at your history and who has a range of options for how to revise it. The third thing might be to read up on the topic. One of the best things you can read, I think, is a special report that I put together that is on a website that we have, which is called www.revisionbariatric.com. And on Revision Bariatric, it's free. It'll send you a special report that I've worked on that goes through the different types of revisional procedures and a little bit about the pros and cons of data, things that you need to know. But the most important thing is to know that there are excellent, very safe, very non-invasive revisional procedures that are available for a failed sleeve in particular, and that they work really well, kind of in the 90+% ballpark. So it's gotten much better in recent years. So those are the things I would urge you to do, and again, don't consider it your failure at all. If anything, it's our failure as scientists, as surgeons. So don't take that blame on yourself. Just seek how to get healthier, how to live a long, healthy life. In most cases, there are tools that will help you get there. All right, I wish you great luck and great health.